Okay, good morning, everyone. I'd like to start by acknowledging that we're gathered on the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat people. And I am thrilled to be here. Really, really happy. And I want to start, I'm very happy to be here with my wonderful colleague, Mark Holland, our health minister, and with the amazing team at Sparkling Dental Hygiene. We just had a chance to talk to one of their patients. I am here with David, Dr. Abraham, here he is, with Loida and with Marcella. And they've started to treat Canadians who are now able to be covered by our dental care plan. It was really moving for me to talk with you guys and to talk with one of your patients and to hear how having this plan in place means people are going to be able to afford to get their teeth taken care of. Loida was telling me and Mark how awful it's been to have people not be able to afford to get their teeth taken care of and only come to see their dental hygienist when they're really in pain. And what she said really broke my heart, that by that point, it can be too late and you have to extract the person's tooth, which is painful, means they lose a tooth, probably really expensive, bad for everybody. And I'm sure for Dr. Abraham and Marcella and Loida, as healthcare professionals, it must break your heart when the people you want to care for can't afford to be cared for. So I am really, really just thrilled that we're changing that. Okay, I do want to start by sharing some good news about our economy. Inflation fell to 2.7% in April. That is down from 2.9% in March. For 4 months in a row, inflation in Canada has been within the Bank of Canada's target range. It is now at a 3-year low, and wages have now outpaced inflation for 15 months in a row. This is great news for all Canadians. With our fiscally responsible economic plan, our government is doing everything we can to support the Bank of Canada and to help make it possible for the bank to lower interest rates as soon as possible. I know for small businesses, that is something really important. Our budget is about ensuring fairness for every generation of Canadians. And a strong healthcare system is essential to ensuring fairness, because no matter your age or your income, every Canadian deserves to get the high quality health care they need. That's really part of Canada, part of being Canadian. Et c'est pourquoi l'année dernière, nous avons annoncé un plan historique de 200 milliards de dollars sur 10 ans en matière de soins de santé pour réduire les retards, améliorer les soins de base et diminuer les temps d'attente. C'est pourquoi nous avons présenté un projet de loi pour mettre en place la première phase d'un régime national et universel d'assurance médicaments au Canada. Celui-ci assurera une couverture universelle pour de nombreux médicaments contre le diabète et rendra les contraceptifs gratuits. And that is why last year we launched our new Canadian dental care plan. Because up until now in Canada, you've been able to tell how much money someone makes or how much money their parents earn by their smile. That's not right. That's not fair. And so I'm just delighted that our country, our government, is now changing that. I'm really happy to announce that as of this week, 2 million Canadian seniors have been approved to receive coverage under our new Canadian Dental Care Plan. That's 2 million seniors across Canada who are now able to get the dental care they need. And if you haven't signed up, one of the reasons that we're here talking about this is go online or phone and see if you qualify. We just spoke to Raphael and he said it was actually really easy to do. And Marcella and Loida have said that a lot of their patient, they're treating people who've signed up. It's really, really worth checking. Maybe it will mean you can afford to go see a dentist when it's tough now, or maybe it will mean if you're already seeing a dentist that you'll have a little bit of extra money, because we all know that life is challenging right now. I'm also so glad to announce that there are now close to 10,000 oral health care providers, including Sparkling Dental Hygiene right here on St. Clair in Toronto, offering services to patients covered under the Canadian Dental Care Plan. This includes dentists and dental specialists, independent dental hygienists, and denturists. I really want to thank the amazing, warm, kind, thoughtful people here at Sparkling Dental Hygiene and all the dental care providers who have signed up for supporting our dental care plan. The work you do is really, really important. You're keeping us healthy. And I'm just so grateful to you, to the 3 dental care providers we have here with us, but also to everyone who works on this across Canada. En juin, la couverture de notre régime canadien de soins dentaires sera étendue aux enfants de moins de 18 ans et aux personnes qui bénéficient d'un crédit d'impôt pour personnes handicapées valides. Les enfants de moins de 12 ans sont déjà couverts par la prestation canadienne provisoire qui a été lancée en décembre 2022. Elle a permis à plus de 440 000 enfants d'obtenir les soins dentaires dont ils ont besoin. Altogether, this means that next year, 9 million uninsured Canadians, people who have been paying out of their own pockets to get their teeth taken care of, will have dental coverage. Our Canadian Dental Care Plan is already making a real concrete difference in the lives of millions of Canadians. Millions of Canadians who won't have to wait until they're in real pain and only come see their dentist, then have to spend a lot of money and end up maybe having to have their teeth pulled out. Instead, people can come and get the regular care they need. And for many Canadians, our dental care plan means they will no longer have to choose between taking care of their teeth and paying their bills. That's what fairness is about. Now, we know that there are some, like the Conservative leader, who don't share our priorities. Pierre Poilievre has already voted against this budget. He's been clear that he opposes making the very wealthiest pay their fair share so that we can afford to make these essential investments in our new Canadian Dental Care Plan, so that we can afford to deliver the opportunities that all Canadians deserve. En réalité, le chef conservateur ne se soucie pas de faire en sorte que les parents puissent se permettre d'amener leurs enfants chez le dentiste. Il ne se soucie pas non plus de savoir si les personnes âgées peuvent s'offrir des prothèses dentaires. Alors que le Parti conservateur cherche la moindre excuse pour réduire les investissements dans les Canadiennes et Canadiens, notre gouvernement agit maintenant. Et il le fait résolument parce que nous savons que les Canadiennes et Canadiens comptent sur nous. And it now gives me really great pleasure to hand it over to one of the key people who is working so hard to make all of this happen, my friend and colleague, Minister Mark Holland. Over to you, Mark.
Thank you so much, Chrystia. Merci beaucoup. C'est un grand plaisir d'être ici aujourd'hui. Pardon pour ça. Oui, absolument. Ici à Sparkleen. Sparkleen, thank you so much for hosting us here today and for taking part in this program. You know, I want to say to Marcella and Loida and to Dr. Abrams, thank you so much for helping folks who need that help. And you've always been there. And I know a lot of times you might have had to take patients on a basis of not being compensated, you know, and I can't imagine how hard it is, as Chrystia is talking about, seeing folks come in a really bad state of oral health because they've been afraid to come in because they can't afford it. And so they have to wait until they're in a state of crisis. And that is totally unacceptable. You know, when you think about what that means to have a smile that you're proud of, that is such a fundamental issue of dignity. And one of the things that is so incredible for me, and I know it is for you as well, Chrystia, as we go across the country, is to be able to see seniors have the pride of knowing they're seen and cared for, that they can have a smile that they're proud of. And to be able to talk to oral health professionals like yourselves who now have somebody come in and not have to worry about money. And when you're talking to them about an oral health regime, that you can give them the care that they need. Now, that's going to be improved because in November we're moving to pre-authorization where we can make sure that we have a simple, easy process for you to be able to get at more complicated care and to be able to approve all the care that folks need. But let's think about this in very real terms. 90,000 people, 90,000 seniors have so far received service. That's an extraordinary number. But it's made a lot more extraordinary when we have an opportunity to meet with somebody like Raphael. And when seeing Raphael, who I see back there, you know, who's got a big smile on his face, right? Because he knows that he doesn't have to make that choice of, you know, where do I cut in my budget for essential items to get the oral health care that I need. And it isn't just a matter of dignity. Of course, it also is a matter of preventative health. You know, as I travel the country and I visit emergency rooms and I talk with dentists who are pulled into circumstances, seeing patients who are in an absolute critical condition, who are in hospital settings because of the fact they didn't get care. And so we have dentists who say, look, I know who doesn't have care in my community, and I know I'm going to be called in on some Saturday to do an emergency procedure for somebody who doesn't have money to pay for it. The cost of that is extraordinary, and frankly, I don't think it's the kind of society that we want to have. Where else in health will we accept somebody's health getting so poor and so awful that something was preventable, and yet we wait until it's so bad that they wind up in an emergency room? So it's an issue of affordability. It's an issue of social justice, and certainly it's an issue of prevention. And I think, you know, having one of the greatest healthcare systems of the world, as we strive to have the greatest healthcare system in the world, this is something that we absolutely must get right. So as Chrystia said, we have 2 million seniors, which is an absolutely extraordinary number. We're almost 10,000 providers. To put that in context, just a few weeks ago, we were at 5,000 providers, so that number is growing every day. We have a new portal coming July 8th. We're working tirelessly as a government to make sure that everybody has that option as we go over the next 9 years to make sure that everybody gets the oral health care that they need. Again, I want to thank Sparkleen for hosting us today. I want to thank you for the work you do for your patients. I want to say how important oral health is. I want to say to everybody, make sure that you see a dentist or a hygienist and know that that's an option, that you can see a hygienist, you can get your teeth cleaned with a hygienist as well as a dentist. Use all the options available to you so that we can have the best oral health in Canada, which will mean a huge difference for our overall health system. Thanks so much, everybody. Nous sommes prêts maintenant pour les questions.
So it'll be one question, one follow-up, and we'll take additional questions if time permits. Please state your name and outlet before asking your question. Il y aura une question et un suivi. Veuillez indiquer votre nom et votre média avant de poser votre question.
Michelle Song, CBC News. My first question is for Minister Holland. Are you on track to expand eligibility of dental care to teens and people with disabilities next month? And have you encountered any challenges in doing so?
So yes, we are, and I'm excited to say that, and I should add it. Next month, in June, we will be expanding dental coverage to those who are under the age of 18 and to persons who receive the disability tax credit. So we're on track to open that up. And at the same time, just shortly thereafter, as I mentioned, July 8th, the new portal will come on. So I think that'll bring a lot of providers. The other thing that I'll add that I think, we had an opportunity here to talk with Marcella and Lloyd specifically about this issue is around the administration, making sure that's as simple as possible. We've got a 48-hour service standard to make sure that providers participating get their payment right away. That's huge from their administration perspective. And so I think as providers are talking to other providers and they're seeing that this is a really easy plan to participate in, that we're going to see those numbers grow. So yes, we're getting more people eligible and at the same time growing the number of providers.
En français?
En français, absolument. C'est des bonnes nouvelles. Pour le mois prochain, les soins dentaires vont être disponibles pour les personnes moins de 18 ans et pour les personnes handicapées. Et aussi, on va augmenter le nombre de dentistes et des autres professionnels dans le domaine de soins dentaires, de s'assurer que chaque personne peut obtenir l'accès des services que la personne a besoin.
The government House leader said they will push to make sure the pharmacare bill gets passed before summer. Did the New Democrats force your government to prioritize this in order to maintain your supply and confidence deal?
Look, there's no one forcing anybody to make sure that women get access to the contraception they need. There's no one forcing anybody to make sure that diabetes patients get the medication that they need. That is a good example of what I think Canadians expect. Shared priorities, parliamentarians working to get things done. Now, unfortunately, there has been the House leader, and I used to be in that role, so I have some understanding of it, is having to navigate conservative obstruction. And what I will say, and this is extremely frustrating to me, it's fine. You want to vote against, folks getting diabetes medication or contraceptives. You want to be against people getting dental care. Okay, then vote against it. But don't try to sabotage it. Don't use parliamentary procedures to block the elected will of the House from doing its business. And certainly don't go and spread misinformation and disinformation about these programs to try to actively get people to not participate in them. I think the thing that's called to every one of us, particularly in this moment, is that we have to put the people that we serve first, not our partisan interests. And I think that's the standard by which we should all be evaluated. And again, I have no problem with people having different values or wanting to vote differently on things. But when you stand in the way of service and you stand in the way of people getting what they need, I've got a big problem with that.
En français?
Pour moi, c'est totalement inacceptable de l'utiliser les tactiques d'obstruction, de bloc, les législations vraiment importantes pour les personnes d'avoir l'accès pour les médicaments que les personnes ont besoin ou pour le soin dentaire. Oui, absolument. Pour les partis conservateurs, si la valeur est différente, j'ai aucun problème de voter contre un projet de loi. Mais de l'utiliser les tactiques comme l'obstruction, c'est pas acceptable. De l'utiliser les mauvaises informations, de bloquer quelqu'un d'obtenir le service essentiel comme les soins dentaires ou l'accès pour les médicaments, pour moi, c'est pas acceptable.
And I just have a few questions for Minister Freeland. Should Loblaw be able to make a deal with Glentel, a company owned by Bell and Rogers that pushes other telecom carriers out of grocery stores? What kind of intervention is needed?
Thank you for the question. And, we are very proud as a government that we are making a historic once in a generation change to competition law in Canada. Because the fact is, things are challenging for a lot of Canadians. A lot of Canadians are really struggling to pay their bills at the end of the month. And we recognize that we need more competition in the telecom sector, more competition in the grocery sector. That is the way that we get prices down for everyone. Canadian competition law currently doesn't sufficiently require there to be competition. And that's why we have put forward a generational change that is going to force more competition into the Canadian market. That may sound a little bit abstract, But the reality is these changes are going to make life more affordable every day for Canadians. They're going to make it more affordable to buy your groceries. They're going to make your phone bill more affordable. That's why it's so important. And that's why, as Mark was saying, it's really unacceptable at a time when many people are struggling to have the Conservatives continue to filibuster legislation, to have the Conservatives continue to prevent measures that people need right now to be passed into law so that we can force more competition into groceries, more competition into telcos, so that Canadians can get the things they need and not pay too much for them.
En français?
Merci pour la question. Notre gouvernement est fier d'introduire les changements historiques dans la loi sur la compétition. Nous comprenons que nous avons besoin de plus de compétition dans le secteur d'épicerie, de plus de concurrence dans le secteur des mobiles, des téléphones. Mais aujourd'hui, on n'a pas une structure législative qui nous permette d'introduire plus de concurrence. On comprend cela. Pour cette raison, on a introduit des changements générationnels, vraiment historiques. Ils vont vraiment améliorer la vie des Canadiennes et Canadiens, de monsieur et madame tout le monde. La chose qui est complètement inacceptable, comme mon collègue le ministre Holland a juste dit, c'est que les conservateurs continuent de bloquer notre législation. Et cette législation qui va changer concrètement, va améliorer concrètement la vie des Canadiennes et Canadiens, nous allons continuer de travailler jour et nuit pour introduire ces changements qui vont vraiment améliorer la vie des Canadiens et Canadiennes.
And just the last question. Interpol said today Canada ranks among the top 10 countries when it comes to the most vehicles stolen, then exported abroad. Many of them are stolen here in Toronto. What kind of message does that send about Canada?
Well, thank you very much for that question. And I was very glad to be in Brampton with my colleagues, Minister LeBlanc, the Minister for Public Safety, Minister Varani, the Minister of Justice, with the Commissioner for the RCMP, with one of the senior leaders of the CBSA, and also with Mayor Patrick Brown and many of his city councilors. The fact is that auto theft is unacceptable. This is a real challenge in the lives of many Canadians, in the lives of many of our constituents here in the GTA. It makes life scary. It makes life more expensive. It raises the insurance rates for everyone. And it is just not okay. And that is why our government is working very, very hard with all levels of government, with law enforcement at all levels, at the Port of Montreal, at intermodal stations, to crack down on this and really to stop it. The reality is we need more tools to do this, and those tools are also in legislation we have put forward before Parliament. We have toughened anti-money laundering rules and created more tools to enforce those rules. We are also seeking to actually ban some of the equipment which is used to steal cars. We need the legal tools to do this. Those tools are before Parliament right now. Frankly, I can't see any reason that anyone wants to help car thieves, that anyone wants to slow down our work and the work of our hardworking law enforcement officers across the country and here in the GTA to really end this. So, again, I would just say law enforcement agencies are working very, very hard. all orders of government. You asked specifically about Toronto, the provincial government, the municipalities. We are all laser focused on this. We do believe more tools are necessary, so let's pass that legislation so we have the tools to end this.
Next question.
Tom Stepanek, CP24, and this is for Minister Freeland. Good morning, Minister. The Conservatives have quickly sent out a rebuttal to your announcement today on the Canadian Dental Care Plan, and their two primary points are that so far only 30% of providers have signed up to administer or take part in this plan, and even the president of the Canadian Dental Association has refused to sign up. So do you have any response to that, or you can send it over?
Mark has something to say. I have something to say too, but it's Mark's area, so I'll let him start.
Well, I think the Conservatives' tune keeps changing on this. When we were at 5,000 members, they said, well, there's nobody participating. We've nearly doubled those numbers in a period of just a few weeks. And what we've heard from providers across the country is that the process is easy. One of the things that's deeply frustrating is that the Conservatives have spread a lot of misinformation about this and have deliberately tried to scare providers, telling them that it's incredibly complicated, that you're not going to get paid, that it's going to take an enormous amount of time. I think they're cheering for it to fail. And again, I don't have a problem with the Conservatives voting against it. I don't have a problem. They can take a position and run an election that they're going to take dental care away from people. But trying to actively cheer and work against providers participating or seniors getting care, I've got a major problem with. And the dental associations, we've been having incredibly constructive conversations. We know that the PEI Dental Association recently came out, commended the plan. The other dental associations, we've really answered all of their concerns. I'm talking to them, and just as recently as last week in New Brunswick and Nova Scotia, with very positive conversations there. So I think that we're getting there. This is the largest program in federal government history. The fact that we already, in just the opening couple of weeks, have seen 90,000 seniors is absolutely extraordinary. There are literally tens of thousands of seniors being seen every single week. And I mentioned, Raphael, what that means to individual seniors. So I know the Conservatives are cheering against this plan, but I would ask them to stick to voting against it and running on their platform against it rather than try to actively block service. Or you know what? Why not get on board? Why not, instead of trying to scare people about this program, talk to providers and give them the straight facts about how easy it is to use this program? Why not get on board with seniors who need dental care to make sure that they get access to that dental care? There was a lot of prognostications that we weren't going to see more than 15% of providers. In just a couple of weeks, we're at 30% of providers. There's certain areas of the country where we have almost everybody joining. And in fact, the more in regions when we have providers join, because they can see how easy it is, we're seeing an explosion of numbers anywhere anybody's participating. So I think the information speaks for itself, and I think those comments reflect clearly on what their values are here.
Yeah, and I just want to add two things to what Mark has said. We should be frustrated, but not at all surprised by the Conservatives coming out against dental care. This is something that Canada has needed to do for a long time. I think a fundamental thing about being Canadian, something that makes me really proud of our country, is we have a universal single-payer healthcare system. We're a country where if you get sick, it doesn't matter how rich or how poor you are, you get the same great care. And I think that's such an important part of our society and who we are. And what's been missing is somehow we decided it didn't count when it came to your teeth, which is sort of ridiculous when you think about it, and also really horrible. And, hearing people who spend their days taking care of Canadians, taking care of, our oral health, and hearing them having to actually have people only come to be taken care of when things got so bad they couldn't stand the pain, and that what was holding people back was money, that's not the kind of Canada I think we should live in. And so when the Conservatives oppose this, we have to understand what they're saying. What they're saying is we don't want kids whose parents don't have enough money to pay for them to go to the dentist. We don't want those kids to be able to go to the dentist. We don't want seniors who don't have enough money to go to the dentist to be able to go to the dentist. To me, that's absolutely awful, but it is consistent with what Pierre Poilievre's Conservative Party stands for, which is austerity, which is cuts to the social safety net we have already, and certainly opposing furiously any effort to make it even better. And one of the reasons that they are so opposed to fairness for Canadians, to fairness for every generation, is they recognize something that we recognize too, which is if you're going to provide Canadians with the care they need, and if you believe, as we do, that you need a fiscally responsible economic plan, an economic plan that allows us to bring inflation down so that the bank can be in a position to bring interest rates down, and those things are tremendously important for us, then if you also know you need to make investments in Canada and Canadians, if you need fairness for every generation, then yeah, you have to pay for these investments. And we have a clear way to pay for these investments with our plan for tax fairness. The Conservatives are opposed to that plan, and that means they are opposed to dental care for teenagers, to dental care for seniors, to our $200 billion investment in Canada's healthcare system.
And one last question for Minister Freeland. Regarding interest rates, opponents will argue that perhaps it's the wrong time to let the foot off your gas as far as interest rates go. The concern is that if the Bank of Canada were to lower interest rates in the foreseeable future, inflation would return. We know that at this point in time, a kilogram of beef, for example, is roughly $3 to $4 more expensive, despite the fact that interest rates have slowed. That beef compared to where it would have been about 4 years ago. Do you share the same concern? I know that you are interested in working with the Bank of Canada to help or to hopefully lower interest rates, but are you not concerned that with doing that, interest rates or the costs of goods and services will continue to rise again and inflation will increase?
Yeah, thank you for the question. Of course, the decision on interest rates is the decision that is taken by Canada's independent central bank. And we respect the importance in our overall financial system of an independent central bank. We respect the bank's independence. And by the way, that is quite different from the Conservatives, who have recklessly called for the governor of the Bank of Canada to be fired. We recognize that a stable Canadian economy, a stable Canadian financial system absolutely includes an independent central bank. What we also recognize is that something the bank is looking at closely is fiscal policy. And so after we published the fall economic statement, I included in the fall economic statement 3 very specific fiscal guideposts that were sort of a commitment saying these are going to be, when it comes to fiscal policy, when it comes to government investments in Canadians, we're going to stay within these guideposts. After that was published, the governor of the Bank of Canada said, this is really helpful to me. This is helpful in the fight against inflation, and this is helpful when it comes to our decisions about interest rates. And so when we were putting together the budget, and we knew that it was really essential to make important investments in Canadians, to make investments in things like dental care, which by the way, it's just so great that we're doing it. I'm really proud that as a country we're able to move forward. We knew we had to do it in a fiscally responsible way, and it was absolutely crucial for us in putting the budget together that we stayed within those fiscal guideposts. And we did. The governor of the Bank of Canada, after we tabled the budget, recognized that we stayed within those fiscal guideposts, and he said again that that was helpful. We also heard from Moody's, one of the credit ratings agencies, that after the budget reaffirmed our AAA credit rating, that's the highest you can get, with a stable outlook, saying, yeah, Canada has a sustainable fiscal policy. Why is all of that so important? Because, as the Bank of Canada has said, responsible fiscal policy, which the federal government has, our responsible fiscal policy, is essential in the fight to get inflation down. And here in Canada, we're seeing the results. We have now, for 4 months in a row, had inflation within the Bank of Canada's target range. In April, inflation was 2.7%. That's the lowest it has been for 3 years. These are really, really important numbers because we all know that high inflation has hurt Canadians, has made life a real challenge. And we also do know that interest rates, which the Bank of Canada has raised, are a challenge too. And the bank has been clear, inflation needs to come down. It is. So we know the role that we have to play. We are we have been very intent and focused on that. And I think all of us and all Canadians were really, really glad to see the positive inflation numbers that came out yesterday. Thanks.
Next question.
Bonjour, Hugues Cormier, City News Toronto. We have a couple of questions from our bureau in Ottawa and Toronto as well. According to the PBO report, that's for you.
Our government recognizes the absolute importance of housing and the housing crisis. And, our budget was about fairness for every generation with 3 critical areas of investment. Number 1, housing, and we have the most ambitious housing plan of any government in Canadian history. Nearly 4 million additional homes to be built on our plan up to 2031. That is a lot of homes, and that is a great thing. We know that is what Canadians need. Number 2 pillar in the plan is making life more affordable, including great things like dental care, which we're highlighting here today. And the third thing is investing in Canada and Canadians with investments like our massive $5 billion investment in research, in our universities, in students, in postgraduates, and postdocs, and doing all of it in a fiscally responsible way. So housing, absolutely central. That includes supply, getting more homes built faster. It includes investments in more affordable housing, which we are absolutely focused on. I absolutely agree. We need to continue to do more, and we're going to.
Today we hear that Norway, Ireland, and Spain will recognize a Palestinian state. Should Canada do the same?
Canada's long-standing position has been to call for a 2-state solution. That's the path to lasting peace in the Middle East.
That concludes today's press conference. Merci tout le monde.
Thanks so much.
Okay.
Really appreciate you letting us be here today and to say hi.